Hello, welcome back again. My today's lesson is about Erythema Infectiosum. This is also called fifth disease or parvovirus B19 infection. Erythema Infectiosum, often referred to as fifth disease, is caused by human parvovirus B19. Its spread seems to be by respiratory droplets and by percutaneous exposures to blood or blood products, with high rates of secondary infection among household contacts. Infection can occur without symptoms or signs. When we see pathophysiology, parvovirus B19 causes transient suppression of erythropoiesis that is mild and asymptomatic, except in children with underlying hemoglobinopathies such as sickle cell disease or other red cell abnormalities such as hereditary spherocytosis, who might develop transient aplastic crisis. Also, immunocompromised children can develop protracted viremia, which lasts weeks to months, leading to severe anemia or pure red cell aplasia. Erythema infectiosum can be transmitted transplacentally, sometimes resulting in stillbirth or severe fetal anemia with widespread edema or hydrops fetalis. However, about half of pregnant women are immune because of previous infection. The risk of fetal death is 2 to 6% after maternal infection, with risk greatest during the first half of pregnancy. When we see signs and the symptoms of erythema infectiosum, the incubation period of this problem is 4 to 14 days. Typically, initially manifestations are non-specific or flu-like symptoms such as low-grade fever and slight malaise. This is the time at which a patient is infectious. Later, several days later, an indurated confluent erythema appears over the cheeks, which gives this name as slapped cheek appearance, and symmetric rash appears that is most prominent on the arms, legs, often extensor surface, and the trunk, and usually sparing the palms and the soles. The rash is maculopapular, tending toward confluency. It forms reticular or lacy patterns of slight raised, blotchy areas with central clearing, usually most prominent on exposed areas. The rash and the entire illness typically lasts 5 to 10 days. However, the rash might recur for several weeks, exacerbated by sunlight, exercise, heat, fever, or emotional stress. Diagnosis of erythema infectiosum is most of the time clinical. The appearance and the pattern of spread of the rash are the only diagnostic features. However, some enterovirus might cause similar rash. From this, rubella is one of them. Rubella can be ruled out by serologic testing, and most of the time in the case of rubella, an exposure history is important. Serologic testing is not required in otherwise healthy children. However, children with a known hemoglobinopathy or immunocompromised state should have CBC and reticulocyte count to detect hematopoietic suppression as well as viral testing. In children with transient aplastic crisis or adults with arthropathy, the presence of IgM-specific antibody to parvovirus B19 in the late acute or early convalescent phase strongly supports the diagnosis. Parvovirus B19 viremia also can be detected by PCR, which are generally used for patients with transient aplastic crisis, immunocompromised patients with pure RBC aplasia, and infants with hydrops fetalis or congenital infection. Treatment of erythema infectiosum is only symptomatic, and acetaminophen or ibuprofen is effective for treating fever, and IVIG has been used with good results for patients suffering from parvovirus B19 with pure red cell aplasia. In summary, children develop low-grade fever, slight malaise, followed several days later by an indurated confluent erythema on the cheeks, which is called slapped cheek appearance, and a symmetric rash that is most prominent on the arms, legs, and the trunk. There is mild, transient suppression of erythropoiesis that is asymptomatic, except sometimes in children with hemoglobinopathies and other red cell abnormalities. Risk of fetal death is 2 to 6% after maternal infection, with risk greatest during the first half of pregnancy. Testing is done mainly in children with transient aplastic crisis or adults with arthropathy. Treatment is symptomatic, but immunocompromised children might benefit from IV immunoglobulin. This is all about erythema infectiosum. Thank you for watching.